July 1863, Gettysburg. When bandages ran out, battlefield surgeons turned to what native healers had known for centuries, a common plant that could stop hemorrhaging in minutes. This plant was called yarrow. For 3,000 years, it saved lives on battlefields and in apothecary shops like this one. Today, we're rediscovering why. The ancient Greeks called it Achilles after Achilles, the warrior who used it to treat his soldiers' wounds during the Trojan War. By the 1880s, every frontier doctor carried yarrow in 3 forms: dried leaves for poultices, tincture, and powdered root. The Cheyenne called it wound medicine. The Cherokee used it for cuts, nosebleeds, and fever. When Civil War surgeons saw it work, they added it to their field kits immediately. This old apothecary ledger shows that yarrow sold more than any styptic remedy. Farmers bought it for livestock wounds. Mothers kept it for children's nosebleeds. Now let's learn how to identify this plant. Yarrow grows wild across North America, in meadows, along roadsides, anywhere the soil has been disturbed. Look for feathery, fern-like leaves. The flowers appear white or pale pink, clustered flat on top, blooming from June through September. The 19th century apothecary knew how and why harvest yarrow on dry mornings, after the dew evaporated, when the plant's oils were most concentrated. Cut the flowering tops and upper leaves. Leave the root system intact for next year's growth. But what makes this roadside weed powerful enough to stop a soldier from bleeding out? Yarrow contains what 19th century physicians called astringent principles. These are compounds that cause blood vessels to constrict and tissues to tighten. The plant's leaves and flowers hold achillane, a substance that promotes rapid blood clotting. The most common battlefield preparation was yarrow wound powder. Simple, fast, effective. Here's how it was done. They would grind dried yarrow leaves and flowers to a fine powder, consistency like flour, fine enough to stick to the wound, absorbent enough to draw out bleeding. They'd sift it through muslin to remove any woody stems. The finer the powder, the faster it worked. It was stored in a sealed glass jar, away from moisture, clearly labeled. The powder stayed potent for 1 year. The battlefield protocol was straightforward. Pack the powder directly onto the bleeding wound, apply pressure, hold for 2 minutes. The powder would form a natural clot. Bleeding stopped within moments. But the same plant that stopped bleeding on the battlefield also fought fever, calmed anxious nerves, and eased digestive complaints. Let's look at those preparations. When fever struck, the apothecary reached for yarrow tea. The preparation was simple: 1 teaspoon of dried yarrow flowers steeped in boiling water for 10 minutes. The tea promoted sweating, which helped break fevers naturally. The Cherokee had used this same method for centuries. During the Civil War, when quinine was scarce, yarrow tea became the standard fever treatment in field hospitals. The same tea also treated stomach complaints. For cramping, flatulence, and indigestion, yarrow tea worked as an antispasmodic. The same preparation as the fever tea, but taken after meals. The bitter compound stimulated digestion, while the anti-inflammatory properties calmed irritated stomach lining. European apothecaries had prescribed this for dysentery. American frontier doctors used it for everything from food poisoning to chronic digestive disorders. The 19th century apothecary also prepared yarrow as a tincture for what they called nervous complaints, what we might recognize as anxiety or insomnia. Fresh yarrow flowers and leaves were packed into a jar, covered with alcohol, usually brandy or vodka, and left to steep for 4 to 6 weeks. The resulting tincture could last for years. The standard dose, 1 teaspoon in water, taken before bed. It had a mild sedative effect, helping patients sleep without the dangers of laudanum or other opiate preparations. Yarrow still grows wild across many continents. You'll find it along the same roadsides, in the same meadows where the 19th century apothecary harvested it. The plant hasn't changed. The compounds that stopped bleeding on Civil War battlefields still work the same way. The achillane that sealed wounds then still constricts blood vessels today. The tannins that fought infection in frontier cabins still have antiseptic properties. Modern herbalists continue to use yarrow in much the way their predecessors did. The wound powder? Still prepared the same way, ground fine, sifted through muslin, packed onto cuts. The fever tea? Still brewed with 1 teaspoon of dried flowers, steeped for 10 minutes. The digestive tonic? Still taken after meals for cramping and bloating. You'll find yarrow in modern healing salves for inflammation, in creams for eczema and skin irritation, in herbal tea blends for respiratory support. The applications haven't changed, only the packaging. Only our memory of this knowledge has faded. Before we part, if you're truly unwell or facing a serious injury, always seek a physician. What you've learned today is history, not medical advice. These remedies worked in the 19th century. They saved lives on battlefields and in frontier homes, but they belong to another time. Uncle Henry's apothecary is a window into the past, nothing more. The knowledge hasn't disappeared, only our memory of it has faded. Perhaps it's time we remember.